why people not able to get good score in this scenario, because they don't, it's a very sensitive. Okay.
Yeah.
You have to tell that. So the Breaking Bad news structure is slightly different. And the Breaking Bad news structure for HIV, every breaking, because we'll be doing a Breaking Bad news in one separate day. But I would like to do this myself, and the most common mistakes, what we do and how we go with the flow. Never ever finish your station before time. I will not, because you paid £1,000 and it's a highly competitive exam. So always score yourself on the data gathering part. A lot of people start managing management too early. What would happen when you start management too early? You will not get good score in data gathering part. If you need to get good score in data gathering part, you 100% need that you ask all the relevant questions. You need to ask all the relevant questions. What are the relevant questions? If it's a follow-up station, I'm going to tell you 4 questions. If a follow-up stations, I'm going to share my screen quickly again regarding the sexual history part. So what questions would be asking? Let's say the same scenario, I'm going to show you algorithm, and after that I will do that. So there are few of the things. Your exam is quite nearby. What I need to do, out of my working hours, I would arrange 1 hour almost after one day, 2 day, because the few of the things you have good things. Let's say you have 10 things. Out of 10 things, we just need to work on 3 or 4 things. If you understood that, trust me, it's only approach, and you're able to crack that exam. But I don't want to say that you're not prepared, because you already have all the information, but you delivered it too early. You delivered it. You didn't took those relevant pauses. It just need a little bit of just delivery, how to deliver it, when to wait it, when to eat time.
Yeah.
Okay, so like May said, you had to wait at that time, because in most of the scenarios, examiner just want you to don't speak. Like Breaking Bad news, they don't want you. They when the patient is speaking, you just listen, give them some time, give them time to even. I'll try to do that thing in real life, how we do that, and what would be doing that. So what type of scenario it would be, and what is the general approach you might see. So let's show you this approach, and after that you guys will understand how to do that scenario anyway. So in this scenario, basically, STI common approach, swelling in the ground. The patient would say, I came with the flu fever, now it's swelling in the ground. He took the swelling history very well. Please tell me more. So start with the recap of your previous consultation. Tell me why you was there, what symptoms, what the doctor told you, what was the symptoms, why they was doing that investigation, what blood test did they mention, why was the blood test done, how, when, how long this pain is like about. So your history is divided in 2 parts: previous history and swelling today, the previous visit and today's health. So you have to take that history, you will be scored on that. Change over time, ask those questions, then ask few symptoms today. How's it feeling? Fever, lumps and bumps, anything like today. Diarrhea, ask other symptoms like rash, because you're ruling out all the STI as well. So then after that, you will do the flaws: fever, weight loss, lumps and bumps. Bowel, you lose motion is one of the sign of the STI. And the patient might say, doctor, can I have AIDS? AIDS means a syndrome. At the moment, you would say, no, it's a treatable thing. It's one of the complications of HIV is AIDS. But I would like to give you hope. I would like to tell you, a lot of people living with the unfortunately, it's a long-term condition, but you would be definitely living a good life, because the treatment is here. What would be the treatment? You will explain. So then you skipped sexual history. You had to take sexual history again. Why? Why you will ask about stable partner? You need to ask about wife. You need to ask about wife, male or female partner, any other partner, sexual, these things you would ask. Contact tracing, but contact tracing here is not important. The patient centered. The patient is worried he got HIV, and you're saying, tell your wife, tell your partner, first give him some time, be human, be a good human. So give him time, give him hope, and after that, at the end, talk. Is that possible? You speak to your wife. Okay. Then signposting thing about that. STI things, recreational drugs, you can ask, but anyway, the history shouldn't be that much detailed, because you need some time for Breaking Bad news. Have you given a thought? Any concern as specific, biggest worry, expectation, anything you're expecting today? So ice was missing. You again asked, what do you think it could be? Or what's going on? You did ask us, ice, but you started in the start. And then you will mention the chevron. Well done. So you'll explain about the sexually transmitted diseases, HIV. I'm sorry, it's not a good news. And then breaking barrier structure. At this point, I need to speak something very sensitive to you. Is that, and I will be explaining everything to you. You don't need to do the setting like you want someone to be here with no problem. You don't need to, but you will explain. Give urgent treatment required. I tell them, give him hope. I understand it's a tough time. First, he will be in denial that I don't think so. Then you would answer that. Usually, I can repeat that blood test for you, but unfortunately, I'm afraid to tell you. Usually, when we give results, those are results we double check, and the results are fine. But if you want, I would do that. But I'm afraid, unfortunately, your test is positive for HIV. Give urgent treatment if required. All cases like need to be referred to the gum clinic. Again, I tell them that what treatment you need here. So explain the patient. Explain it's a long. We need to treat it. We need to check the viral load. It's a viral infection. We need to start with medication 6 months according to the viral load. We need to control the viral load. And this is how that sounds to you. Then sports groups, don't worry about that. We are here to help you all the time. We will explain that. So let's do this scenario. So what? Let's do this scenario again. The same scenario. I'm going to show you. Yes. Asia, definitely I'll try to do it, and I'm going to show that scenario as well, what type of scenario you might see. So I'm going to open that scenario, HIV results. So I'll show you what type of scenario you might see. Right. So you're able to see my screen now. So you might say, see a 35-year-old male came for a follow-up at a gum clinic. 2 weeks back, he had a flu-like symptoms for which he saw a GP, was told it could just be a flu, was followed up in 2 weeks' time. A week ago, he developed swelling in the groin for which the GP did some STI test. Today, he's here for results. So there are two presentations he would tell. So first I go to the GP, I had a flu-like symptom, that I had a swelling. Then today I'm here for the result. He traveled to Thailand. So you didn't ask about